Understanding ulcers is important for managing your digestive health. These small but painful sores can significantly impact your quality of life if not properly managed. An ulcer is a sore that forms on the lining of your stomach or the first part of your small intestine, known as the duodenum. These sores can vary in size and severity, and they often cause a burning or gnawing pain in the abdomen. Imagine a small open wound inside your digestive system. This wound is exposed to the harsh environment of your stomach, which is filled with acidic digestive juices. That's what an ulcer is. It's a break in the lining of the stomach or duodenum that fails to heal properly, leading to persistent discomfort and other symptoms. These sores can be quite painful, especially when they come into contact with stomach acid. The acid not only irritates the ulcer but can also make it worse, leading to more severe pain and complications. Ulcers don't just appear overnight. They develop gradually over time, often starting as a minor irritation that worsens with continued exposure to stomach acid and other aggravating factors. They develop over time due to various factors. These can include bacterial infections, prolonged use of certain medications, and even lifestyle choices such as diet and stress levels. One common cause is a type of bacteria called Helicobacter pylori, or H. pylori. This bacteria is found in the stomachs of many people and can lead to inflammation and ulceration of the stomach lining. This bacteria weakens the protective lining of your stomach and duodenum, making them more vulnerable to damage from digestive juices. Over time, this can lead to the formation of ulcers. Another contributing factor is the prolonged use of non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and aspirin. These medications, while effective for pain relief, can have a detrimental effect on the stomach lining. While these medications are helpful for pain relief, they can also irritate the stomach lining over time, increasing the risk of ulcers. It's important to use these drugs cautiously and under the guidance of a healthcare professional to minimize potential risks. Recognizing the symptoms of an ulcer is crucial for seeking timely treatment. Ulcers are sores that can develop on the lining of your stomach, small intestine, or esophagus. They are often caused by an infection with the bacterium Helicobacter pylori or long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin. One of the most common signs is a burning pain in your abdomen, usually between your breastbone and belly button. This pain can be quite severe and may be described as a gnawing or stabbing sensation. This pain may come and go, often worsening on an empty stomach or at night. It can sometimes be temporarily relieved by eating certain foods that buffer stomach acid or by taking acid-reducing medications. Other symptoms to watch out for include nausea, vomiting, and in some cases, vomiting blood, which can appear red or black. Feeling bloated or full quickly after eating, which can make it difficult to enjoy meals or maintain a healthy diet, and a loss of appetite. This can lead to unintended weight loss and nutritional deficiencies over time. Some people with ulcers may also experience heartburn, which is a burning sensation in the chest that can be quite uncomfortable. A burning sensation that travels up your chest. This can sometimes be confused with the symptoms of acid reflux or gastroesophageal reflux disease, GERD. While heartburn is more commonly associated with acid reflux, it can also be a symptom of an ulcer. If you experience any of these symptoms, it's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. Ulcers are painful because the open sore is exposed to the harsh environment of your stomach. The stomach is a highly acidic environment designed to break down food and aid in digestion. However, when the protective lining of the stomach is compromised, the acid can cause significant damage to the exposed tissue. Your stomach produces hydrochloric acid, a powerful digestive juice that breaks down food. This acid is crucial for digestion, helping to break down proteins and other components of your meals. Without it, your body wouldn't be able to absorb nutrients effectively. While this acid is essential for digestion, it can irritate the sensitive tissue of an ulcer, causing pain. The ulcerated area lacks the protective mucus layer that normally shields the stomach lining from the corrosive effects of the acid. The pain can range from a dull ache to a sharp, burning sensation. This discomfort can be persistent and may interfere with daily activities, making it difficult to focus on work or enjoy meals. It often worsens when your stomach is empty, as there is no food to buffer the acid. The absence of food means that the acid comes into direct contact with the ulcer, exacerbating the pain and discomfort. Eating may temporarily relieve the pain, but it can return a couple of hours later as your stomach empties. This cycle of pain and temporary relief can be frustrating and may lead to changes in eating habits as individuals try to manage their symptoms. Section 4. Lifestyle changes. Your path to healing. Making positive lifestyle changes is essential for healing ulcers and preventing their recurrence. One crucial step is to quit smoking. Smoking weakens the stomach lining's ability to heal and increases the risk of ulcers returning. Limiting alcohol consumption is also important, as alcohol can irritate the stomach lining and interfere with healing. Additionally, managing stress is crucial. Stress can increase stomach acid production, which can worsen ulcer pain and delay healing. Section 5. Dietary adjustments. Foods that help and hinder. What you eat can significantly impact ulcer healing. Avoid foods and drinks that irritate your stomach, such as spicy foods, acidic fruits and juices, caffeine, and carbonated beverages. These can aggravate ulcer pain and slow down the healing process. Focus on a bland diet that is easy on your stomach. Good choices include cooked vegetables, fruits low in acidity like bananas and melons, lean protein sources, and whole grains. These foods provide essential nutrients without irritating your stomach lining. Section 6. Stress management, reducing the burden. Stress can exacerbate ulcer symptoms and hinder healing. Finding healthy ways to manage stress is crucial for both your physical and mental well-being. Engage in activities that you find relaxing and enjoyable. Deep breathing exercises, yoga, meditation, and spending time in nature are all excellent ways to reduce stress. Make time for activities you enjoy, such as reading, listening to music, or spending time with loved ones. Section 7. Healing and beyond. Taking control of your health. Healing from an ulcer takes time and commitment to lifestyle changes. By following your doctor's recommendations, adopting a healthy diet, managing stress, and avoiding irritants like smoking and alcohol, you can promote healing and reduce the risk of ulcers returning. Remember, you are in control of your health. By making positive changes and prioritizing your well-being, you can overcome this challenge and enjoy a healthier, happier life. If you suspect you have an ulcer, consult your doctor for proper diagnosis and treatment.